HCPs, healthcare professionals, should develop strategies to identify patients at risk of emergencies, assess the severity of those risks, and, where necessary, recognize the need for help and be able to seek advice from a colleague with special competence in the relevant fields. Let's learn about some common emergencies and how to deal with them. First, anaphylaxis. It is an acute condition and look for signs of collapse, rash, angioedema, and wheezing. Take action. First, call for assistance. Second, give oxygen 15 liters per minute. Third, give adrenaline, epinephrine. 500 mg for adult IM, 0.5 milliliters of 1 in 1,000 adrenaline. Legs up position. Fourth, alert emergency services. Second, angina. Angina presents as severe chest pain, typically responding to glycerol trinitrate. Take action. 1. Call for assistance. 2. Give oxygen 15 liters per minute. 3. Administer glycerol trinitrate, 2 puffs sublingually. 4. Alert emergency services only if there's no spontaneous recovery after the initial action. Third, asthma exacerbation. It caused breathless, wheezing, speechlessness, possible cyanosis. Sit the patient up and forwards. Take action. 1. Call for assistance. 2. Give oxygen 15 liters per minute. 3. Administer salbutamol, 2 puffs of 100 micrograms for an adult, inhaled via a spacer. 4. Alert emergency services only if there's no spontaneous recovery after the initial action. 4th, cardiac arrest. Severe chest pain not responding to glycerol trinitrate. Look for collapse, pallor, breathlessness, and sweating. Take action. 1. Call for assistance. 2. Give oxygen 15 liters per minute. 3. Administer glycerol trinitrate, 2 puffs and aspirin, 300 milligrams sublingually. Begin CPR. 4. Alert emergency services. 5th, choking. Choking due to inhaled foreign material. Look for coughing and choking. Take action. 1. Call for assistance. 2. Give oxygen 15 liters per minute. 3. Perform 5 back slaps, then 5 abdominal thrusts. 4. Alert emergency services only if there's no spontaneous recovery after this action. 6th, epileptic fit. An epileptic fit may cause a sudden collapse. Seizures can occur and maybe even incontinence. Take action. 1. Call for assistance. 2. Give oxygen 15 liters per minute. 3. It's crucial to protect the patient from harm. Consider administering midazolam, 10 milligrams for an adult, in the buccal mucosa, or intramuscularly, or sublingually. 1. Alert emergency services only if there's no spontaneous recovery after 5 minutes, or if the patient has a persistent altered conscious state, or if the fit characteristics are different from those previously described. 7th, faint. A faint might lead to a collapse, but typically the patient responds well to laying flat. Look for pallor, a slow pulse, and sweating. There's usually no chest pain. Take action. 1. Call for assistance. 2. Do not give oxygen, not essential, but oxygen may not harm. 3. Lay the patient flat and give glucose orally. 4. Alert emergency services only if no spontaneous recovery after action occurs. 8th, hypoglycemia. It can cause confusion or aggression, often in individuals with known diabetes. Look for signs like shaking or tremors. Take action. 1. Call for assistance. 2. Give oxygen 15 liters per minute. 3. Perform a blood glucose assay and give a glucose drink, gel, or tablets. If the patient collapses and is unconscious, administer glucagon, 1 milligram for an adult, intramuscularly. 4. Alert emergency services only if no spontaneous recovery after action occurs. Ninth, stroke. A stroke can present with facial weakness, arm weakness, and speech difficulties are also common indicators. Test all the above actions. 1. Call for assistance. 2. Give oxygen 15 liters per minute. 3. Alert emergency services, only if no spontaneous recovery after